Management of a Psychiatric Patient. By Jones H.M., MBA-DMS. 1. Aims. To promote rest. To maintain an optimum nutrition status. To prevent injuries. 2. Environment admission. The patient is admitted in the psychiatric ward. The environment should be clean to prevent nosocomial infections. The room should be well ventilated to promote comfort. The room should be well lit to prevent injuries. Patient may be isolated to protect other patients from injuries. Have the necessary medication such as diazepam to use when need arise. Consider having the door to the room closed at all times so as to stop patient from running away. 3. Psychological care. Talk to the patient in a calm way so that they find it easier to understand. Avoid whispering when talking to others in the presence of the patient so that you don't instill fear in the patient. Explain the patient's condition to the family to promote family-centered care. Give unbiased information about the patient to the family to earn their trust. Allow the family to be part of the care that the patient is receiving as the family is constant in the patient's life. Allow patient and family to ask questions pertaining to the condition to allay anxiety. Explain the condition in simplest terms to promote understanding. 4. Observations. Observe patient for behavior. Is patient still hyperactive or improving? Observe the feeding pattern and if poor, prepare meals for the patient. Observe for any signs of social withdrawal and engage patient in some activities. Observe patient's sleeping pattern and promote rest. Observe for the general condition of the patient. Observe for hallucinations and act accordingly. Observe the drug effects on the patient. 5. Nutrition and hydration. Monitor the feeding pattern of the patient. Encourage a normal but balanced diet to promote a good nutrition status. Encourage oral fluids for hydration. If possible, have a feeding chart to monitor and record the feeds intake. 6. Communication. Use simple words when talking to the patient for easy understanding. Always face the patient when passing a message to ensure the message is understood. Consider the language that patient can get when communicating. Gives patient tasks to ensure patient is understanding and stays oriented. 7. Rest. Ensure that the room is free from noise. Do all procedures in blocks. At once. Administer some medication that can help patient to sleep and rest. Ensure that the room supports both mental and physical rest. Administer prescribed analgesia to promote rest. 8. Hygiene. Do assisted baths to promote comfort. Do oral care to prevent halitosis. Change soiled linen to prevent skin excoriations. Do hair care to promote patient self-esteem. Perform nail care to prevent self-injuries. 9. Prevention of injuries. Ensure that the room is free of injuries or objects to prevent harming patient. Monitor patient closely. 10. Rehabilitation. Involve patient in some everyday activities to promote mental development. Involve the friends in the care of the patient and those of his or her age group, especially those that suffered from the same illness, so that they may share experiences. Use a variety of modalities including arts, crafts, drama, music, dance, sports and games as well as community outings to help patients maintain or improve on their physical, social and emotional well-being. Ensure patients with mental or emotional disorders are treated by teaching them to function within their community. Family members should be educated on the patient's condition so as to accept her or him as being part of the family in order to avoid stigma and rejection by members of the family.